Hello everyone, it's Dr. Gupta at the Dermatology Laser and Pain Center. We're going to show you a chin liposuction procedure on a relatively young patient who just has this submental fat that's hereditary. Right, so here I am actually using the Vaser probe to melt away the fat. And you can see some of the yellowish drainage that is coming out right now, and that is actually the liquefied fat that basically the ultrasound breaks up those fat cells and it causes them to implode a little bit under the skin. And then that yellowish fluid, as you can see draining out, is the liquefied fat. This is a much gentler way to do liposuction, where we're not using brute force to basically extract the fat cells, but rather gently melting them. The heat that the Vaser probe also generates during the procedure helps to tighten up the skin even further. So you get this dual benefit of less trauma, which means less bruising after the procedure, less swelling, and also more skin tightening. And as you can see, the patient is very comfortable. She has already been numbed at this point using a tumescent anesthetic, which is comprised of saline, lidocaine, and epinephrine, along with some sodium bicarb to buffer any stinging sensations. So we're still doing the Vaser lipo procedure here, melting away the fat. You can see a nice trickling of the fat coming out of the chin. So at this point now, I am actually suctioning out the fat, and we're using a small cannula to gently glide under the skin, and under vacuum suction, it pulls out the fat cells that have been destroyed, and that fat goes right into the canister. And you can already see during this process how it's sculpting out her neck and her chin area. You can see how her skin already looks a lot more taut and firm. And now I'm moving over to the other side and doing a little bit more defining with the probe, getting some more of the fat out and just giving her that nice chiseled appearance. The recovery time is really quite easy after this procedure. There are no stitches that we place into the little puncture sites. They will close up within 24 to 48 hours. There might be a little bit of drainage during that time, and she'll just need to wear her compression garment, ideally for 2 weeks straight if she can. In some smaller patients, we might not need it for quite as long, but in general, about 2 weeks, and then no strenuous activities or heavy lifting for that 2-week period as well. And she will see results pretty much immediately, but within a week, you will see even more definition. And as that swelling continues to settle down and you get more collagen stimulation in remodeling, this can continue to get better and better for even up to a whole year. Thank you so much for watching.